Welcome back to PHAMCAST. In this special series, we've kicked off really shining a light on my passion, my profession, that I'm so proud to be part of, massage therapy, beyond the table. I'm here with Leanne Monaghan of Staying Alive Fitness, and I'm so excited to now dive in after hearing her story, such a powerful one, and really looking at how privileged we are to be massage therapists. Now it's talking about integrative collaboration and innovation as massage therapists. This is something I'm very, very passionate about, something that I have led the way for 33 years in doing, long before it was kind of cool or sexy to do so. But what excites me is that the ripple effect is happening, and many massage therapists like you and so many other that we're going to highlight on the show are doing now. So how do we, as massage therapists, integrate massage therapy into the broader preventative integrative health model? What do you think about that?
The way that I approach that question is, first of all, through education, right?
Absolutely.
Education. And being able to empower as we are educating it. So it starts at the client level. That's what I think.
Absolutely.
It starts right there. So empowering them, and I love the way that you coined that they become the CEO of their health, their own health, and that they feel that they're part of the process.
Totally. They are. They're the most important member of their healthcare team, right?
Yeah.
And we have the privilege of helping to guide them and connect them and bring a community together for them, because community matters. That's how we get outcomes, right?
That's right.
That's
exactly.
that's so important, and you're so right. Education. It's also education, and we both do a lot of this. Educating other healthcare professionals, not, so we've got to educate our clients or our patients, but then it's incumbent upon us as a profession as a whole to educate our peers in conventional and complementary medicine. Notice I didn't say alternative. I don't see massage therapists as an alternative healthcare.
No.
Ever, never, ever, ever have I seen it that way, but rather as a complementary healthcare that we're better together, whether it be with a family doctor, a surgeon, a nurse practitioner, a physiotherapist, a chiropractor, whatever it may be. We play a huge role in that. How have you, in your practice and in your profession, how have you made that connection? How do you value those collaborative connections, both for patients as well as educating the practitioner on what you do? Because the onus is on us to do that.
That's right, 100%. And what I do with my clients is that I help them build a team. Because we are regulated healthcare practitioners, that then allows us, with their consent, to speak to the other practitioners who are involved in the team.
Correct.
And then you're building this community around that client, and the outcomes are so much faster, and and that client doesn't feel that they're in isolation, like the massage therapist isn't talking to the physio
and even more, and it's much better than it used to be, or that there's this almost like a competition, like we're all in silos and we need not talk. Like it's absolutely ridiculous to think that way. The body doesn't work in isolation. One system doesn't work separate from the other. And we're obligated to all work better together with the patient at the center. And I love that. You're absolutely right. With the client or patient consent, we then can be the liaison to connect, to learn from, and to surround that person to get better outcomes. And we see it in real time every day in our clinics.
Absolutely.
How does that, I'm going to do a quick tangent because I really want to get to the heartbeat of massage therapy. When you do that, Leanne, how does it make you feel as a practitioner when you're able to connect and you get an outcome? Like, I don't take for granted when I get a text message, a phone call, or someone's in my treatment room crying and thanking me for an outcome they got, which maybe had been something I did, or maybe a referral that I did that was the breakthrough. How does that make you feel?
It just grounds me even more in gratitude for having this privilege of being called a registered massage therapist. There's no words to describe it. I'm just grateful, and it's not about me. I'm just happy that the client is getting the care and the results that they want.
Right, and I think to that point, what it does is that it fuels us, and I know you're a lifelong learner, as am I, we didn't just take our board exams, become massage therapists, and hone our clinical skills over thousands of patients over decades. But we're also always taking more courses and learning new things in a wide range of things. For many of you that don't know this out there, we have a continuing education program called Strive in our profession, where we, in order to maintain our license, we have to continue to learn and grow. There's a lot of mindset, and I'm going to call it out in our profession, that it's a waste of time, and that and I get it. You're busy, it's hard, but it's critically important to continue to evolve, grow, and learn, even beyond the treatment table. So, as much as taking clinical skills, all the different modalities we were both trained in, I continue to layer my toolbox, and I love that. But I found myself in the last few years taking different types of courses to make me a better clinician, a better person, a better leader, and a better founder of things like preventative health. So things like mindset and leadership, courses on leadership. I know you believe in that too. Can we speak to that as a massage therapist and why that impacts both the way we interact with other healthcare professionals and the way we interact with, whether it be our clients or future clients? How important is it that we continue to learn and grow, both clinically, but also with things, and you do a lot in this. You speak a lot about mindset and workshops on that. Let's talk about that from a leadership lens.
Oh, this is heart be still.
Yes.
I love this question. It empowers you and it gives you more confidence.
Yes. As a practitioner.
Yes.
And as a person. Yeah.
And that's the key, because that's what's getting transmuted energetically to your client.
Absolutely.
To anybody that you interact with, like you and I.
Yes.
And it gives you the confidence, because I'm not in scarcity and lack. Oh, it's my client and I don't want to refer that out, and then I'm not going to have like my fee, and am I going to be able to pay my mortgage? No. It's as we collaborate, and true leaders, like you just said at the beginning, empower other leaders.
Yes.
And when we collaborate, because we're coming from leadership, then the boat rises.
It does, and leadership is defined in different ways. So there's leaders that are leading others, but then there's self-leadership, and that's one of the things that massage therapists have the opportunity to do, to teach and exemplify or illustrate through their actions to their clients how they can be a leader for themselves. That's why I coined Become the CEO of Your Health. Because we live in a society, and certainly a healthcare system, this pill for nil, wait till it's broken, reactionary sick care system, where we really have worked and lived in the preventative, proactive, patient-empowered system for 30 plus years. But that mindset shift, it's no easy task to change, because people, and it's human nature, do we want a quick fix? Sure, we all do. Do we want to go to our doctor and say, fix me, doc, and maybe pop a pill? And I'm not against that when there's a time and a place. But really at the core of what this discussion we're having right now is understanding not only the privilege you have to lead yourself, but how it's required. And that you are in the driver's seat of your health. And as a massage therapist, we get to show people how to self-lead. And when people's lights go on till they realize, I didn't know how to help myself, and now my massage therapist, through the education they're doing, through the connections they're making, the light bulb goes on. I did that. I spoke to my doctor with confidence, and now I'm getting X done.
Yes.
That is a role that I don't think a lot of massage therapists are really listening to and recognizing they're not harnessing the power. You do that brilliantly. And self-leadership from that lens has to be talked about.
It's and again, it's an inside job.
Yes.
All of this is an inside job for you as a massage therapist, and it means that you embody, not just speak, but you embody the wellness that you are
trying to give out.
Exactly.
Yeah.
And when you move and model professionalism, when you move and you model self-care, people notice, and it's unspoken.
And when you authentically and courageously share the reality of life's, and we're not perfect, and we fall off. You shared your story, I've shared mine. I just was saying before the show that in taking caregivers care for others, both personally and professionally, and I have put myself on the back seat of my health because I've been caring for others, that's on me. And I knew it. But us being honest and we're not perfect. We don't pretend to our patients and our clients that we're perfect, because there's a relatability with professionalism and respect, because of course there's that line that we walk as regulated health professionals. However, there's a way to do that, to share honestly and authentically, to lead by example, but to also say, hey, I get you. I've been there.
Yes.
I know how easy it is to struggle or to not make all the right decisions all the time, but I'm here to help.
And it makes you more relatable and more inspirational when you can professionally and tactfully, like you said, because we do have boundaries that we have to adhere. And again, that will empower the client even more. Because they can see themselves through you.
And what I love about that is that our profession is so diverse. It can treat so many different conditions. It really is, from pregnancy through to palliative care. And there's, like you were saying, about this mindset of scarcity and competition. I think collaboration over competition every day, all the time. I love to elevate other massage therapists, even that, when I owned my clinic that were next door, I'd refer to them. Because here's what I know, which speaks to your point. When you speak from your authentic self and you share your stories authentically and professionally, there is a client base, a patient load for you, apart from you. Because they need what I have, and they might need what Leanne has, and I might refer to her later. But the point is, there's room for all of us at this table as a massage therapy profession. And then all of that diversity in what we offer as massage therapists, because we bring something different with our skill sets, with our experiences, with our training, with our mindset, that we then can collaborate differently with different allied health professionals. And that's what makes us, in my opinion, one of the most versatile and powerful and impactful professions around in healthcare.
Agreed.
And you see that, right? And yet we also see the frustration, or at least I feel it, I shouldn't put words in your mouth. I sometimes get frustrated of therapists sort of, there's no room, I'm gonna say it, there's no room for jealousy in our profession.
None.
There's no room for, I'm better than, or these are the only leaders. There's room for every single massage therapist to be elevated, to stock their toolbox. And that's what this series and the preventative health movement, where massage therapists started to bring not just massage therapists together, but all these other healthcare professionals, now 80 plus. And you're a FAMCAST, right?
Yes.
And a proud one at that.
Absolutely, yes.
And it's in those conversations and in leaning in and thinking differently, that's how we change the legacy of healthcare in this country.
Yes.
With massage therapy at the center, at the heartbeat, and leading the charge to change policy. And you're doing that. You're doing that in the conversations. We both do lunch and learns for physicians. You do leadership works. We're gonna be coming back here in a few moments, and we're gonna dive into some of that conversation as well. What's the future look like for massage therapy? What are we doing as professionals and as a profession as a whole, to really break down those silos, to make sure we're heard with other professionals, and to find the way that we're going to play a really important part in the future of healthcare in this country. Leanne, you're going to stick around.
I am going to stick around.
I'm so excited to continue to dig in. Stay tuned. We'll be right back here at FAMCAST for segment 3 of this epic episode, all about massage therapy beyond the table and how it integrates into preventative and integrative medicine.